Hello, everyone. I'm Dr. Diana Bitner from True Women's Health, and I'm here tonight to talk with you and with my new partner, Dr. Egan. We're here to talk about primary care and why you need a primary care doctor. We've entitled this, We Want to Be Your Doctor in the Family. And we think about this in different ways. I think about this as we want to be your person who explains stuff, who is there when you need us. We're there in a proactive way. And I care about this subject because I want every woman to have a doctor in the family. I want her to have someone who is managing things, who's in front of things, and there to help her plan her health. So on that note, I want to introduce Dr. Celia Egan. She's now been with True Women's Health almost 1 year, and it's just been a very fast-moving year.
Holy cow, I can't believe it's been a year already.
It can't. When is the actual date? I'm not sure.
August 16th is the day I think I officially first started.
That's amazing. I just can't even believe it. So I care about this so much because I want to make sure we have expertise at True to really cover every aspect of a woman's health, from weight gain to high blood pressure to heart disease, but also to help a woman put it together. Why do you care about this?
It's funny because a lot of times when I'd be, trying to find different roles, people would ask me, are you a primary care doctor? Are you obesity medicine doctor? And I was like, I'm a primary care doctor at heart. And it just so happens that a lot of people, women in particular, are seeking out obesity medicine. So primary care to me is honestly the main reason of why I'm here and what I feel is my calling as a physician, right? And my role in women's lives. And how I see that is so, as you put it, is really trying to be their doctor in the family, right? I think of this as someone that's there to provide expertise and experience to patients who come in with health goals and concerns. And then together we come up with a plan. And there's a lot of different aspects to that, right? So there's the preventative aspect. And we talk so much about that at True in terms of, how are we going to get to some healthy aging, right? What do we have to do to use lifestyle management tools to get there? And then there's dealing with sick visits and making sure we don't miss anything serious. And then there's just, the relationship, providing support in really hard times and everywhere in between.
Exactly. When you talk about relationship, I'll never forget, 27 years ago in my first year of practice, I got to spend some time with Dr. T. Barry Brazelton. Some women, will know and will have read the book Touch Points. And I got to spend a week with him, a famous pediatrician in Boston. And what he taught me was it is never, ever, ever a physician's job to tell a patient what to do. It is our job to provide anticipatory guidance, meaning this is what's going to happen as you age. This is going to happen when you get a period. This is going to happen when you're pregnant. For me as an obstetrician, this is what's going to happen when you go into labor. And so as we talk about what's going to happen, then we get to build this sacred relationship with the patient. It's a very trusted relationship because when that thing happens, you guys out there, the patient is like, oh, maybe they do know something. And then we develop this really great relationship where I don't have ego invested in what a person does, none of my business, but I get to offer options and explain why a certain thing is happening.
Yeah.
And that's one of the reasons I love OB so much is I got to have these, again, sacred relationships with women during their pregnancy, deliveries, needing a hysterectomy, whatever the case. I think you value the same thing. And when we met, we both got that about each other.
Yeah. And I think, I think there's so many aspects to a woman's life that aren't just in this office, right? It's, who's in their life in terms of relationships, either with a partner, with their parents, with children, with their bosses, employees, right? Their friends. And it's so important to spend some time and get to understand who's important to them and what's important to them. Because when we're making big time decisions about what to do with diagnostic testing, meaning trying to look for other diseases or treatment, like are we starting new medicines? Are we going to go see a surgeon or go see a specialist? You need to know all that stuff, right? You need to know who's important in their lives and where their relationships are, because that all is so intertwined with the next steps of healing, right? Of workup and healing.
Yeah, well, it's a big part of overall health, like what is going on in their lives. And I'll never forget when we first started True, I was on Facebook Live introducing True. And what I said was, at True, we want to get to know you, but more than anything, we want you to know you. And I think we both tell people it's not fair that I know more about your body than you do.
Mhm.
I want each and every one of my patients to know all about her body, why she gets headaches, why she's gaining weight,
Yeah.
why she's in a bad mood, why she doesn't feel good, why she's tired. And again, I love that about your approach as well, is you want people to understand and progress forward in their health at their pace.
Yeah. And I think we both get that, in order to be in that mental space as a patient, right, where you feel comfortable asking maybe a question about, I don't know, about having weird bowel movements or having abnormal, symptoms when you're having sex, really personal things, or feeling like you're asking the same question over and over again. You got to have that sacred relationship, right? Because then
Mhm.
we both know that we're in an okay space to ask those questions. Where if you, maybe see someone once a year, once every 3 years, it's just not the same relationship.
Exactly. And so I think about, again, what we do is primary care for the whole woman. And at True, not only are each one of us providers very comfortable in each other's space to a limit, right? We stay in our lanes. I am not an internal medicine doctor, but I know enough to be comfortable and I know when to say, you know what, let's call in Dr. Egan. And Dr. Egan, for you, now you're a certified menopause practitioner, NCMP behind your name,
Mhm.
but yet I get to be there to help when maybe there's some questions. So, and Suzanne with her training in functional medicine and cancer survivorship, I just love how we get to provide that holistic care for each
Yeah.
woman, no matter where she starts.
Yeah, and I think that it's something that happens behind the scenes, but we really do have case presentations where the three of us, and including our physical therapist and our therapist, sit down and kind of talk out loud some of these times when patients are coming with symptoms we don't quite understand or just cases that we're concerned about. And I think that that's so important to know that we care so much about our patients that we're willing to have big open discussions about what we need to do next so we have a really concrete plan moving
Right.
forward that we're all comfortable with.
Yeah, I love our team meetings. I mean, we take an hour out of the day every week and we meet as a team. And I love how when I left today, you were in the break room, our kitchen area, talking to Ashley, our therapist, about a patient that you were concerned about and, how to maybe have some language around that. And so, again, being in that team-based approach, we have a room where we all work together. We have an office space where all of us providers have our desks together. Like it's all about us having that conversation and again being able to really provide that care. See, I love how you think about logic behind tracking visits, like how we came together. Do you want to talk about that?
About how we came together as
Yeah.
a team. I think I had so many patients that came into my primary care office when I was in a prior practice talking about how, Dr. Bitner had helped them so much, particularly with hormone replacement therapy. And, I it planted just this question in my mind. It wasn't really something that I understood and was comfortable with. And so, who is this person? And she seems to be, I was really listening to patients. They felt better, right? They were not feeling well. Now they felt better. And so it was something I didn't understand. And so I really wanted to get more information. And so, I reached out doctor to doctor, lady to lady saying, hey, I need to know more about what you do. And I think that we met and I really loved, not only did I learn about hormone replacement therapy, but I learned so much about, what we call waypoints, right? And this sort of your plan to get patients to understand themselves and the structure of like healthy aging that I think is just so important that really doesn't in modern medicine doesn't really quite have a framework like that. No
Right.
place in modern medicine has a framework like that.
Yeah, cool. And I think about wellness like deliberate well-being, like we're making choices to reach our goals. And
Yeah.
again, as let's say, hormone specialist, a gynecologist, a women's health doctor, I want to work with a primary care doc or talking about, let's say, heart issues, who understands the hormones. But yet I want to tell you, of course, that I'm a hormone doctor who understands there's a heart, right? A woman is a whole person,
Right.
not just pieces and parts.
And I think something that is so important that you understood is that we still need to talk about diabetes, even if someone doesn't have diabetes, right? We still need to sort of say, let's just touch base on your way your body handles sugars, right? Let's reflect on how did your body handle sugars during pregnancy, right? Because those things are really important versus kind of the older model is let's just wait until you have diabetes and then we'll deal with everything from there. But I don't think that from everything I've seen sort of in my obesity medicine world and in primary care, it's we need to be a little bit more proactive than that. And that's why I love our office's approach of reviewing that stuff with patients and kind of inspiring and hopefully getting patients to a place where they're like, yeah, what is going on with my blood sugar, right? I should know what this is most of the time.
Exactly. So I think this might be a good time to talk about our different programs. I so want you all to check out our new website. Our company, our communication company, Leverage, has just done an incredible job. We had lots of questions wanting more and more to understand the differences between our programs. And so our new website, we believe, is just so exciting, but it shows really clearly what those programs are. So I wonder if we want to talk about, because where my mind went was to talk about how do we define wellness? And we define wellness in terms of what a patient wants for herself. How does she want to age? What does she want to be like at a certain, let's say, milestone event? And so in those different programs, we talk about, first of all, the basic program. And so do you want to talk about basic wellness?
Yeah, so basic wellness is, women who have a primary care doctor outside of our office, but really need some help with, their symptoms surrounding menopause and their changes of reproductive phase. And so you'll be seeing, Dr. Bitner and Suzanne and all of our other amazing staff, right? And talking focused a lot on sort of where they're at and where you'll be at in terms of your phase of ovarian function, and seeing if there's any medications or treatment plans that make sense for you to sort of manage some of those symptoms that come with menopause and as we go through perimenopause and menopause.
Right. And for that basic program, also having access to our therapist, to our chef, Anna, and being able to come up with a plan. But the program we just love talking about is our complete wellness program. And with complete wellness, you have access to everyone in our office, to Dr. Egan, to Suzanne, our PA, and to myself, as well as our therapist and our amazing staff. 24/7 access via our texting app. And again, we get to be your doctor in the family. You have a question. The other day, we had a question about a mammogram. It was a normal mammogram, but she had questions about the exact words in the report. We got right back to her and explained it. And she said, I just love not having to wonder what this means or having to ask the Google. I get to ask my experts.
I'll fully admit, obviously we love people to be part of the complete program because we're really bossy and we like to be the ones that are in charge, right? We want to be the doctor in the family, right? So I fully admit we're a little bit biased that I like to be the main primary care doctor running the show. But it really does sort of provide this space where we can do just so much in terms of healthy aging, making sure we're taking care of all of your sick visits and sort of tracking everything that we need to do to sort of get your kind of health plan together. And that can have a couple of other different facets to it.
Right. I, met with a patient last week, and she came in for a meet and greet to understand more about True. So, if anyone wants to come in and just get a sense, get a tour, get a sense of what we are at True, let us know. But she came in and just said, I just feel like, my mom had a heart attack. I so don't want a heart attack. My dad has dementia. I don't want dementia. My sister is overweight. I don't want to gain any more weight. Help me understand this. And, and she was wondering about perimenopause and is hormones safe for me? And because of her medical history, it might or might not be. And so I certainly could answer some of those questions. And again, talked about the options. And again, for her more complex medical history, it really is important that she has all of us. And she signed up for the complete program. And she's like, I can't believe I can have everything here in one stop shopping.
I feel like that's a pretty frequent comment that we hear, that everyone's just pretty excited that they don't have to sort of search for all these different facets to happen in terms of, getting your gynecology and internal medicine sort of in one place, and also seeing a therapist if that was, something that people needed. I think that it's really important in having us all communicate in a really easy and effective way. I know I've had a couple of patients that, were looking for questions behind primary care. So for instance, one patient, we sort of had a discussion about kind of the timing of her colonoscopy, and it was a little bit different than she had heard from her gastroenterologist. And it was just having this space where we could talk on the phone, right, for 5 to 10 minutes. And she felt so comforted of saying, oh yeah, now we have a plan, right? Instead of just kind of sitting and wondering and worrying, and I guess I have to wait till next year, right? Or maybe I'll send a message and get a week back, get a message back in a week. And we just love creating that space where women just feel comforted. I mean, let's be honest, women out there are just doing so much for so many other people, right? We're doing awesome at our jobs. They're being awesome mothers and caretakers, awesome partners. And, we just don't need one more thing on our plate to have to think about all these sort of other things that build up sort of in this, aging world.
Right. And, sometimes there comes a need for, let's say, referral. I had a lady with a hernia the other day and needed to be referred to a general surgeon. I put the referral in, and before she left the office, she had an appointment. If she needs a CAT scan before she leaves the office, not always, but we can get that scheduled. Mammogram, we can schedule them. So it's just, we want to make this easy for you, and we can check these things off your list. So you can do what you do. I had a patient who said, I just want to do what I want to do as long as I want to do it when I want to do it. I just want to feel like myself and do what I do. So we want to be able to check those things off your list for you.
Yeah. Yeah. We definitely, I think, want to provide a safe space to answer questions, right? Like I have a lot of patients that will come in and be like, I looked this up on WebMD. I bet you hate that. I'm like, no, actually, I love it. I love that you have questions. Let's talk about them. Like, pull it out, right? Let's go page by page through what we need to talk about. And I hope women feel comfortable in our space that we made. I'm sure that I know we get so many compliments about how they do feel comfortable, but that's really where we want to be is, any questions on the table, and that we have the space that we can talk about it.
Exactly. And also I'll have patients who come in with long lists and they'll say, I bet you hate this. I'm like, are you kidding? I love this.
Right.
Because when you leave, you will know that you could check all those questions off. You were able to answer everything.
Yeah. Sometimes I think people probably get too many. They're probably like, okay, whoa.
Yeah, well, we'll talk about that. Well, what's the most important for today?
Yeah.
I know another thing you talk about is medication.
Yeah.
Reconciliation. How do you think about that?
So as the list of medications available expands, right? So we're in 2022. If you have a symptom, there's a lot of different medications that are out there. Not only that, but there's a lot of different medications that are being approved, right? So that concept of managing your medications, we call medicine reconciliation. It's important not only for your safety, right? Keeping you safe, knowing what medicines you're taking, making sure that they're at the appropriate doses, making sure that if you need a refill, that they'll be given to you in a timely manner is really critical. Something that I think needs to be said, because I think it's kind of an interesting point to sit with. There's basically 4 different players that are involved in your medicines. There's you, there's your doctor, there's your insurance company, and then there's the pharmacy, right? And so you can imagine there's all these different pings back and forth that are being involved to get you your appropriate medicines that you have to take and use, right? Mm-hmm. So we hope that what we should be doing in a primary care space, right, is being there to sort of field questions, quickly get answers, both from your pharmacy and your insurance company, and maybe any specialists that you had seen that had written you medications. And we try to, do that in a timely manner, as a very fast and in as timely manner as we possibly can. Now, we're not always 100% accurate, right? We're human beings. There's sometimes misfires in communications between maybe the insurance company or the pharmacy, but we're definitely there to sort of reply back and get on it as fast as we possibly can.
Right.
And I think that there's nothing sort of more stressful than not having that available medication that you were hoping to get. Exactly. Right. Not only for acute things such as maybe like a UTI, you're going on vacation. Today, I just talked to a lady who was like, I'm like getting on a plane today, right? And I'm having these symptoms. And I called her. We quickly came up with a medication plan and she got her med right away before she was getting ready to go on vacation. I mean, phew, right? Like you can go on vacation and enjoy yourself, and you don't have to worry about these things coming up and whether or not you're going to sort of get what you need.
Exactly.
Yeah.
I'd like to answer Margaret's question. Thank you. And everybody out there, feel free to put questions in the chat and we can get to them. But Margaret's asking how we work together. So I guess just to step back a little bit, Margaret, I'm an OBGYN by training. I've been in practice for 27, 28 years. I stopped delivering babies a couple years ago. I stopped doing major surgeries a couple years ago so I could focus on midlife, menopause, and sexual health and women's wellness, essentially. And I did a pilot study and published the study. And in 2015, I was Menopause Doctor of the Year, which just really told me I was on the right path. And so I've always wanted to create this comprehensive women's health center with access, of course, to cardiologists, to specialists, but to work together with an internal medicine doctor that really gets, again, the same approach to care in terms of holistic care. And when I met Dr. Egan, it was just an awesome fit because, we can interact in terms of really understanding, especially someone with more complex medical problems, but having her background in all things internal medicine, we work together in a very practical way. So in the complete program, that would be the best example. So for example, when a patient first comes in, she might see me first, she might see Dr. Egan first, she might see Suzanne, our PA, first. And at that visit, we do an hour-long appointment with a complete intake, to really understand, where do you want to be? Where are you now? What are some of the barriers? And how can we make a plan? And, we divide wellness into 9 main areas. So I tend to focus more on the phase of ovarian function. So are you in perimenopause or menopause? I tend to focus on the sexual health. I love talking about bone health. I, of course, love a bit of talking about weight and heart, but mainly then Dr. Egan will focus on overall internal medicine, but also on heart disease risk, diabetes risk. And Suzanne specializes more also in the bones and also in cancer wellness and risk reduction. Celia, do you want to add to that?
Yeah, I mean, I think so I'm an internal medicine doctor by training. So that's the training of adult medicine. I spent a couple of years doing cancer care and inpatient medicine before I sort of continued my love of obesity medicine, which got started during residency. And then I've been doing outpatient care now for like approximately about 5 to 7 years. So I think we have a very well-rounded idea of a lot of issues that in terms of medical care that comes up with adult women. And when I think about working together, a lot of the times it will either be maybe a symptom that a patient's having that we'll sort of bring to the table and sort of talk out loud from all of our different points of view, or, a patient's collective story that we'll sort of talk about and say, does this ring any bells to anybody? Is anyone concerned about anything from this story? And then we'll all sort of bring together what would be the next steps of either treatment or testing to sort of make sure that that patient was staying safe and feeling better.
Exactly. I always tell patients, safety first, happy second. And, for example, I had a patient with terrible hot flashes. She hadn't had hot flashes for a while and then started having them. And of course, my number one concern is, could this be a sign, let's say, of heart disease, which I've seen more than too many times I want to think about. But, hot flashes can be a sign of chest pain. And so, hey, Dr. Egan, this is my plan. What do you think? You're the specialist in this area. And together we were able to address her concerns. She ended up having a stress test. Her heart was good. So then we could proceed with managing things with knowing that she was safe. So we could sort of work around and after several months, of some lifestyle adjustments, some medications, she is feeling awesome. So it was just so reassuring to have Dr. Egan right there, who can take a looked at her chart, and we were able to see. Now in the basic wellness program, that's more of a focus on myself and Suzanne working with the patient and also then communicating with her primary care doctor. So saw a patient today who is, very attached and has a great primary care doctor. Actually, the primary care doctor sent her to us, to help her with her menopause symptoms. And so it's a lovely relationship. So, I sent that note right back to the primary care doc and really look forward to working with him to take care of her because, again, we're each staying in our lane, but we're supporting her as her team.
Yeah. And I think that we feel that way, and we didn't mention it, but just to bring up, we also have a weight journey program, right? So if you're a patient who loves their primary care doctor, but you just need a little extra help with weight, we have a program where that's what we would focus on, right? Talking about lifestyle changes, particularly nutritional changes that would maybe get you back on track with getting to whatever weight goals you wanted to be, or getting your blood sugars or blood pressures under better control. And then using some of the, newer FDA approved medications that are available to sort of help patients lose weight and kind of work on their relationship with food. So, even if you have a primary care doctor that you just like love and you don't want to leave, we totally get it. And there's a lot of different options to sort of get care still at our office if you're interested in a particular topic.
Exactly. And also then just to round out our programs, we also have a cancer wellness program. So, what's so amazing about current healthcare is that many cancers are now treatable. Breast cancer in the vast majority of women is a very treatable condition, especially if we catch it early. But then unfortunately what happens is a woman survives breast cancer, but unfortunately the chemotherapy might put her into early menopause, which then increases her risk of heart disease. So what we love to do, for example, is help a woman who suffered breast cancer at, let's say, 40 at a young age. We can help her not only feel better and treat those symptoms of menopause, but we can also help reduce her risk of heart disease by getting in front of it. So many women with breast cancer will maybe lose weight during treatment, but then afterwards their weight just skyrockets,
Yep,
which
that's
then
a very
increases their
common
risk of recurrence, right?
Yeah.
And talking about painful sex and sexual dysfunction that can happen because of change in body image, because of menopause, because of sleep disruption. So again, we like to put that all together, and that's been lovely. We also have what's called a silver wellness program for women over 65 who just need that one visit a year, and perhaps it's not in their budget to do the complete program. Then we would want to at least give them access to our clinic. So 65 and over, they get one visit a year. And we call that our silver wellness. And for women under 25, we have what's called I'm blanking. What do we call it?
Empower.
The
Empower.
Okay,
Yeah.
And it's so fun because women will come in, maybe they're 19, they've only seen their pediatrician, they're kind of nervous, like what's going to happen. And then, we talk about sex, we talk about family planning, we talk about overall health. And at the end of the visit, she's like, when can I come back? So it's just been an awesome experience to take women care of all ages. And again, just providing that complete care.
Yeah. Yeah. I think we all love our Empower patients because they're just so much fun to talk to, hear their perspective on life and what their questions are coming into the office.
Exactly. And I'll tell them that I was on speed dial for my daughter's sorority house. So no one can embarrass me. I think I've heard it all. So
that's right. Yeah.
So it's been a really good thing. And so, yeah, I love that.
Oh, that's so great. Yeah. I think that the role of primary care, in some ways has been, in decades ago, right? It was the doctor that came to your house, right? And that's how intimate the relationship was. Right. And then I think it's lost a bit as we don't have enough primary care physicians in this country, right? As more and more doctors have moved into specialists, as we're fortunate enough that there are these all amazing specialists that do a lot of amazing things and save a lot of lives. But at the same time, there is a bit of a void in the primary care space. And so it doesn't mean that it's not important, that it's incredibly valued for a lot of different reasons. And we just love being people's primary care office. For sure. I know our staff definitely does, of creating these relationships with people.
Well, what I like to say too is that all of our staff was hired on purpose. And Amy, our nurse who works mostly with me, but also of course with you, she came to us because she really missed having that personal relationship with patients. And she worked in a great primary care office, but they were super busy. They had to see patients in a short amount of time. And she came to us because she's like, I really miss having that time. I miss, knowing those patients really well. And so it's really fun. I always joke, I want True to be like the Cheers bar where people come in and they're like, Norm. So I love that patients come in and we know them. So it's it's like a family type approach. I know you and I could just talk about this for hours, and I don't know how much people want to hear, but what I'd love to do is we talked about, you wanted to sort of celebrate the year that you've been with us and talk
Dr.
about
B, I have one more topic to talk about.
please.
I think it's really important. So primary care. So we talked about one aspect being healthy aging, another being medication management, and sort of how important what we call medicine reconciliation is for you, and making sure that we're all on the same page between your specialists, your supplements, all those things that we all know what you're taking. The third main topic of primary care that I think is so important that people forget a lot is sort of how doctors think and the point of sick visits, right? So when I don't know, please feel free to interject. But when I'm thinking of patients, right? So we hear their story, we do their exam, and then we come up with a list. We call it differential, right? Of all the different things that it could possibly be, and we do different tests, and we try to figure it out. We rule out serious stuff. We start treatment plans. And then we move through time and we see if anything happens or changes. And let's say symptoms either get better, worse, change. And then we would change our list of things, of illnesses that this could possibly be. And then we change what we would do next. And sometimes what happens to women that I've seen numerous times is, it's all this kind of fragmented care where they'll go to the sick visit, the urgent care and see someone one day. And then the next, 2 weeks later, maybe they'll go and see someone else at a different urgent care, or maybe they'll be in the emergency room, and then they'll finally get into their primary care doctor's office. And what may be happening is seeing all these different doctors you may be really missing sort of a common thread. I know I saw a patient, a couple of years ago who had seen several different doctors, and she had a chronic cough. And for some reason, they never ended up getting any lung imaging, because I think it just, from that doctor at that moment, it always just seemed like a basic cold. And then this went on for almost like a year. And she ended up having like this common fungal infection that we see called histoplasmosis that can, come in from Michigan. And so again, we use time as a tool. If I see someone, on the first day of their symptoms, and as it's progressing over the weeks, I'm going to escalate sort of my thought process behind what decisions I'm making about the next steps in terms of maybe imaging or seeing a specialist. So we use time as its own tool for coming up with our plan for tracking illnesses and making sure we're not missing anything serious. And one of our fears behind not having, enough primary care doctors is that patients may be missing out on this really important tool that comes from a primary care physician's office.
Well, yeah, it's like, what I'll say is like, things that are not that bad get better quickly. If you don't,
Right.
if you don't get better, then we've got to keep looking to make sure we understand. Yeah. But also, how I think about what we get to do at True is that we get to know you when you're well, or maybe there's only a couple things going on.
Yes.
Let's say, your first hot flashes or your first irregular period. So whatever brings you into True initially, we kind of figure that out, but we really get to know you well, especially through our our progress of knowing what are your goals and tell me what's difficult, right? So we really get to know people. So then when you have something that's more concerning, like a chronic cough that's not going away, we already know so much about you that we can put it together maybe even more quickly.
Yeah.
And, and get on it.
Yeah. And I think that as much as we document and try to put into words what we see in the rooms, I know, Dr. B, you'll agree with me, there's nothing like seeing a patient, hearing their story and following them, right? And you can get a snapshot of these people when they're well, but when you're not well, we can see it and we can feel it. And I want, as your primary care doctor, right, I want to be involved in that. And I need to do something and know if you're not feeling well, to make a different treatment change or a medication change, or seek out other help from either another specialist or get a different test.
Right. It's like Sherlock Holmes, it's just, really picking up on those subtle cues. I just love it. One thing that just came up for me too is, we talk about medications and options and HRT, but also just to be really clear with everyone that the basis of everything we do at True is healthy lifestyle. And we use an acronym called SEEDS, or the 7 essential elements of daily success. Medications are tools. I choose to take hormone replacement therapy, makes me feel great. But I'm still going to have a hot flash if I don't drink my water. I'm still going to have a hot flash if I have too much sugar. I'm still going to have a hot flash if I'm sleep deprived. So it's always going back to that 7 essential elements of daily success. And we love tracking those. We love talking about barriers to those. Today, talking to a patient about, she feels so tight and her muscles are more tired. She's not stretching. We talked about yoga. We talked about resources. So it's just really looking at that healthy lifestyle as the foundation of everything we do. And then on top of it, maybe you do need a statin for your cholesterol. Maybe you do need a blood pressure pill. Maybe you do need something to protect your kidneys, again, from high blood pressure. It's all of that. Again, it's having that team approach to add things on, but focusing on that healthy lifestyle.
Yeah. And we hope that, as we get to know patients and patients get to know themselves, that when and if that comes to the decision that we're going to start a medicine like that, that patient feels confident that they literally did everything that they could do. Sometimes it happens. Some people need to be on statins. Some patients need to be on blood pressure medicines. It's not like that patient did something wrong, right?
Mm-hmm.
It's just that that's the way that their body's working. And thank God we're in a space where we have those great drugs.
Exactly.
But at least I hope that patient feels confident that we really did try everything that we possibly could.
Right.
And if you're talking to the same doctor, or at least the same set of doctors, you'll be, I hope, pretty confident that that was a good choice for you.
Right. And I'll tell people, you don't have to take a statin. You get to take a statin.
Yeah.
It's 2022. You don't have to take hormones. You get to take hormones.
Yeah, right.
So it's just really, understanding that.
Yeah.
So I think good. We can talk about you talked about 5 main things you've learned in your year of being at True.
Yeah. Hard to believe I've been here for a year. So I'm going to take over and sort of list off all of my 5 things. So the number one thing, right, is understanding your phase of ovarian function. I will fully admit, right, I mean, obviously I knew that there was a difference between a woman being in menopause and not being in menopause, but I will say it wasn't forefront of my mind when I was seeing a woman, particularly if she was coming in with symptoms, no matter what those symptoms were. And I really have found it so powerful, right, to have that be part of my thought process when I'm thinking of a patient or a woman when she's in my office talking really about anything, right? And thinking, where is she at in her phase of ovarian function?
When I would teach the residents, back when I was at the other position, I would teach our residents, I wish we could say, as we think about a patient, here she is, a 48-year-old female. She's had 2 pregnancies, 2 deliveries, and she's in early perimenopause. I think that should just be in the statement in every woman's chart that we're thinking about her phase of ovarian function as important as her age, because where she is with her hormones dictates her risk of heart disease, her risk of weight gain, her risk of diabetes. So, super, super important to understand this phase of ovarian function. And the other thing I want to say real quick is that I together did a research project with 4 other physicians. It's published, and it looked at the comfort of graduating residents taking care of women in menopause. And we surveyed family practice doctors, internal medicine doctors, and OBGYN doctors. And of all those doctors, everyone, guess what percent of graduates of residency programs felt comfortable taking care of a woman in menopause?
It's low.
6.8%.
Yeah.
So we asked about comfort. We asked about knowledge. We asked about questions about, hormones. So again, no disrespect, but number one, we need to work harder to educate our residents. But again, as a patient, I want you all out there to make sure that you're asking about this. Ask your provider, what phase of ovarian function am I in? And if they don't know, I'm sure they know lots of stuff, but hey, who could I see to work with to put this in part of my story?
Yeah, absolutely. I'm even going to throw one further. I mean, I think that the phase of ovarian function is so powerful. I mean, we may even see it sort of tease into inpatient care, right? Like of the changes that come, like when women are really acutely ill. And so I'm sort of curious to see as the research around menopause gets more vast, if that will sort of start creeping into more even inpatient care and how important this is.
As when COVID was first starting, and I think that the studies have gone on, but there was some, even initial work that women who were on estrogen actually did better with COVID. And there was even a study proposed giving men estrogen with COVID to see if they do better. I think that's a little silly, but truly that study was proposed at a very high level because the data was so powerful. Anyways.
That would have been, I would be interested to see that.
Exactly.
All right. And so the second thing that I learned is sort of the powerful role of hormone replacement therapy in treating menopause. As an internal medicine doctor, I trained at a really great place. I mean, it sort of followed trend, which was, hormone replacement therapy had a black box warning, use with extreme caution, of all these things from all these details that sort of been passed down from, the 1980 studies that had sort of come out. And I will be honest, I didn't really feel comfortable with using hormone replacement therapy, not because I had been told that it had been outrageously dangerous, but I really hadn't been told of the benefits of it. And so I've just been shocked and impressed with how helpful it's been for so many women, not only with treating their symptoms, but, and looking at the preventative measures that come with using hormones.
Right. And, unfortunately, and I'm looking at a journal right behind me from the International Menopause Society, and it's an article written by the editor that talks about how so many women will miss out on the benefits of hormones because it's just the culture, because of the study that came out in 2003, not 1980, but 2003. So it was a long time ago still.
But the studies were from the 1980s, weren't they?
No, but it's all right.
Fair enough.
But it's all right. So it was published in 2003, and the studies were they're still ongoing, the WHI. But when the WHI came out, even for me as an OBGYN, I was told by my senior partner, stop prescribing estrogen. There's a study that shows that it may cause breast cancer. I'm like, okay. I didn't read the study. I was busy delivering babies. But now we know so much more since that study was published in 2003. We know that hormones are very safe for many women, not everybody, but for many women. And we know that some women, especially in that first 10 years after menopause, who take estrogen might even reduce their risk of heart disease. But for sure, it treats bone loss and prevents osteoporosis. It can reduce the effect of the risk of prediabetes. It can help with sleep and symptoms. So again, we could go on and on about that. But again, unfortunately, we in traditional medicine dropped the ball. And because of that, there's just been a whole culture shift. Hormones are bad. I don't want to learn about them. But now we know hormones actually are pretty good. And so now it's just going to be a slow revolution. And the more we can encourage women to ask their providers, have you read the latest studies? Are you a certified provider? And if you're listening to us today from Iowa, you can go on the website menopause.org and find a certified menopause practitioner in your area. So when Celia joined, sorry, you're seeing my cat there. When Celia joined True, she became a certified menopause practitioner, so we could be asking and treating women in the safe way.
Yeah, and I think that there are some ways of that women may get what they would consider to be hormones, right? But that we don't think are as safe. And I think that has brought in the whole treatment plan of taking any hormones really down, unfortunately. Right. And so I think that it can get really confusing out there if you're, a patient trying to figure out what to do with your symptoms, and you kind of hear all these different things from different people. So It's really important to check out someone who really knows what they're talking about, and would be a certified menopause provider.
Exactly. Perfect. So yes.
Yeah.
We've had lots of fun discussions.
All right. So the third thing that I found that's been so exciting is, after cancer, right? So what comes next? And a lot of the times, particularly after breast cancer, which we've sort of already touched based on, it just seems as though, all right, hooray, you survived cancer, like that's it. And
good luck.
Women, yes, right. Send these women out to like the next phase of their life. Some of these women, it's in their 30s and 40s, and that's like not even half their life. And particularly when it comes to sexual health, it really creates a lot of, distress, issues with their relationships. And it's just really uncomfortable and honestly unfair. And so even with hearing about the Mona Lisa and all the other different treatment options that are available for women after cancer, I think has just been so powerful.
Yeah. And it's like women will say, like, it's so unfair. Cancer took away my hormones. It really put a wrench in my relationship with my husband. It's just not fair that it took so much away. Please can help me get some of that back.
Yeah, and I do think that if you're a woman that's out there that maybe is either headed into cancer treatment or coming out, I mean, you're just not alone, and that I think there are some great providers out there, such as our office, that are at least just here to listen to your struggles and, and to be an open ear for hearing what's next.
Yes.
All right. Number 4, thinking about alcohol use in women and the role of monitoring, thinking about it as particularly during perimenopause and after. Of course, as a doctor, I thought about whether or not women were drinking alcohol, but other than just sort of the general like substance use form that we filled out, I wouldn't give as much thought to it. I definitely think my that number that I would tell women that they should stay under has changed and continues to go down as more and more data sort of come out about alcohol's effects, not only on cancer cells, but also on heart disease. And sort of that number getting closer to 0 is becoming a little bit more and more clear, but just having the space to kind of talk about it in terms of even monitoring symptoms, particularly hot flashes, I think has been really important.
Perfect. And what can happen in perimenopause is one of the biggest symptoms is difficulty falling asleep or waking up in the middle of the night. And some women will use alcohol to self-medicate to try to fall asleep. But unfortunately, as that alcohol wears off, then there's increased waking after women fall asleep. So that 1, 2 a.m. wake up, and then your brain starts going and you can't get back to sleep, and you've got to get up and work out and then go to work in the morning. And it just really gets tedious. And the other thing that I talk to a lot of women about is just that habit, that ceremony. I come home from work, I want to sit down with my husband and just have a drink, right? So, it's wanting to respect the ceremony, but instead of a glass of wine or 2, how about this much wine and some club soda? Instead of a craft beer, how about a very light beer, and how about this much? Or how about a cup of kombucha? Our trainer Mitch talks about that, which I just love my kombucha. How about a cup of kombucha for 60 calories versus a craft beer for 300 calories? So it's just really looking at what can we replace that need for ceremony and put it in a wine glass.
And I think as another aspect of alcohol use that I think needs to be brought up, as particularly as we speak to Suzanne about different symptoms, I mean, the role of alcohol and its interplay with our microbiome, which is the bacteria that live in our GI tract and are imperative in controlling a lot of our metabolic health and immune system. Alcohol really wipes out a lot of the good bacteria that are there. And at the very least, it doesn't create a good environment for them to thrive. And so if you're dealing with, GI issues, whether it be diarrhea, constipation, bloating, really thinking about cutting back on your alcohol use is really important.
And it can cause hot flashes. So
who wants that? Diarrhea and hot flashes, right?
Exactly.
Yeah. All right. My favorite topic of all, I think almost my favorite thing that I've learned while working at True, right? If you're a lady that is less interested in sex than you were before, and this bothers you, there are so many great drugs that are out there, right? I was just shocked and surprised about how amazing that is. And definitely in kind of big primary care offices where appointments are 15 minutes at a time. We're definitely not getting to sex, right? So I love that we just have this space where patients feel comfortable talking about their sexual health, and every woman out there should know, for them, there are some choices to get you going again.
There are. When I was in practice for so many years, I would just pray that women wouldn't bring up their sex drive because I had no idea what to say. Right? I would just like, oh my gosh,
shrug and be like, sorry.
Or I'd see it checked on their box, and I'd be like, I'm not. But now, because of my training with ISHWISH and NAMS and, talking to other providers, just like we do at the office, I learned that actually there are a lot of things that we can do. Number one, figuring out why. But for women who, for example, the switch just flips and there's just no desire, or there are 2 medicines that are FDA approved. One is called Addyi. It's a medicine that's a serotonin modulator. So it was being studied like other serotonin medicines for depression and anxiety. But what the researchers noticed that women who were taking this drug, it didn't do a whole lot for depression or anxiety, but it did a lot to help their sex drive. And so these women were like, I might still be anxious, but now I want to have sex. So this drug actually became FDA approved for sexual desire. Not everyone responds to it. About 60% of women will respond. It's an everyday use drug. It's taken at night. And by 3 months, we'll know if you respond or not. but there were definitely not only more sexually satisfying events with these meds, but there were women who wanted to want, and they wanted again. So that's Addie. And the second drug we affectionately refer to as the horny shot. It's called Vyleesi. It's a shot that women give themselves, and researchers thought women aren't going to want to give themselves that shot. Oh, they do. And number two, one of the common side effects is nausea. So researchers were concerned that women wouldn't want to take the shot because they might get nausea. Oh, they want to take the shot, but please, can I have a medicine to help with nausea? So we prescribe Zofran to go along with it just in case. So it's a very effective shot. It's on demand. You can only have 8 shots a month because too much could maybe make your blood pressure go up. But it's a very safe drug, and it's one that we can prescribe. We make sure we see you for a visit, make sure there's no other things going on that might reduce your sex drive, but it's something that definitely is an option. So yes, there are many options, and at True, we're very comfortable talking about sex.
Yeah. And I think one of my favorite quotes that you say is, I mean, you don't have to suffer in silence, right? Not being up to snuff with your sexual health is just frustrating, right? It's frustrating on your relationship, on your partnership. And then that goes into so many other different facets of our life, including our health. So, longevity in terms of that kind of health. So I love that there's so many options out there. Yes. Well, I hope some people learned a little bit more about what we do, how we think about primary care.
Exactly. And, everyone, there are not that many clinics like this in the country. I would, just off the top of my head, there's only 3 other clinics in the country that have this primary care approach with menopause specialists. So we just are very excited for you to check us out. And
we're probably the coolest, let's be honest.
We are the coolest. Yeah. But, we have classes, we have interactive sessions. Our Tuesday talks are pretty popular, where patients of True have access to come in, and I did a Tuesday talk a couple of weeks ago about sex. I know, Dr. Egan, you've done lots of different talks about continuous glucose monitors or diabetes, or that one's coming up. But, we want our patients to not only have answers, have solutions, but also have community.
Yeah. And I think that we love providing this open space where women just feel supported either by each other, by us, and learn to feel to support themselves.
Awesome. So please check out our website, truewomenshealth.com, and we sure hope to hear from you, or even better yet, to see you in person.
All right. Thanks.
Thank you.